But first, there were 450 cases of coronavirus reported yesterday. All 450 were locally acquired. We are now at 2,793 active cases across the state. All but 4 of those have been locally acquired. And it continues to be disproportionately people under 50 years of age who are active coronavirus cases. We now have some 407 children aged under 9 with the virus. We have 449 children aged between 10 and 19 years of age. We have 697 people in their 20s, and we have 485 people in their 30s, all with coronavirus in Victoria. And as I say, 85% of the 2,793 cases are people aged under 50 years of age. So we continue to see, unfortunately, this outbreak being concentrated in the young and the unvaccinated. We have at the moment 143 people in hospital. That is up 17 from yesterday. And we have 34 of those people are in the intensive care units, and 26 of those 34 are on a ventilator. There were 42,765 tests processed yesterday, and we've now begun to see those number of Victorians on the other side of the Murray River in the border bubble wanting to come back home, now starting to have their applications processed, and we're pleased that that trial of the first tranche of those Victorians wanting to come back home from the extreme risk zone of New South Wales has commenced. In regards to vaccinations, today we report from yesterday another record number of vaccinations in the state. Through the state-run clinics, there were 39,148 doses of vaccine administered at our state sites. Each of the last 4 days has seen a record tumble the subsequent day. When you add it to all the other points in which Victorians can get access to vaccinations, be that GPs, be that through pop-up and specialist clinics, be that through pharmacies, we saw just on 87,000 vaccines delivered yesterday. We are now at 65.2% of the eligible Victorian population, that is over 16 years of age, who have received a first dose as we move closer to that 70-dose first vaccination milestone that we are looking at in the short term. We also saw 58,000 vaccination bookings made yesterday, which takes us to over 340,000 vaccination bookings made during this week, which is great, but there are still more capacity out there, and we could do a whole lot more good by getting those vaccines that are in storage into more Victorians' arms. So please continue to come forward in these record numbers, and please continue to get vaccinated. It is just so important to getting us to the other side of this outbreak and to getting us into, as the national plan talks about, a sustainable, safe reopening. In regards to that in particular, I'd just point out that there continues to be 11,000 AstraZeneca bookings right now in our system. So the easiest thing to do is to hop on to the website or indeed phone the hotline and get yourself booked to do your part to keep yourself and our community safe. In regards to those number of Victorians who were hospitalised yesterday, 89% of them were not vaccinated at all, and 11% had had a single dose. Not a single one of the people hospitalised yesterday was fully vaccinated, and the message there is pretty clear. being fully vaccinated keeps you safe, keeps you out of hospital, and more importantly, keeps those that you love and are supporting in your community safe. I wanted to focus on a few issues regarding regional Victoria, if I could. We saw in these numbers yesterday some 8 cases in regional Victoria in today's numbers. There were 5 in the city of Greater Geelong, 3 of which were linked to different construction sites. There was 1 in Kahuna in Northern Victoria. There was 1 in Daylesford in Hepburn Shire, and there was 1 in Beveridge in the Mitchell Shire. The majority of these regional cases of the 8 are all linked back to community interactions in metropolitan Melbourne. Exposure sites have been identified, so please check the website in your area, and of course wear a mask if required, and if you are caught up in either the Tier 1 or Tier 2 exposure sites, please take the appropriate measures of getting tested and isolating according to the risk of the site that you've been at. The cases that are related to construction continue to be investigated by our public health team, both regionally and in metropolitan Victoria. And there's a bit of a crossover with some larger outbreaks in the construction sector together with these regional cases as well. There's a Panorama Box Hill construction site in Box Hill, of course, which has had an outbreak that we've referred to a few times. It's now sitting at 116 cases associated across 3 related construction sites, and it's been one of the most significant outbreaks in this particular outbreak event. Today is day 11 of the testing and isolation of those 3 related sites. So as day 13 tests commence in a couple of days, we would expect the over 300 primary close contacts associated with that site to continue to return more positives. A EY construction site in the city has had 9 cases linked to its construction site, and that reflects a similar pattern of concern, but at an earlier stage of its pattern through its numbers in related to that work site. Of course, construction is quite rightly a permitted activity under the current restrictions. It's a skilled and mobile workforce, but what these positive cases show is that being mobile, it's able to be seeded across both metropolitan Melbourne and a number of the regional settings of Victoria. Construction, together with a focus from the public health team, the industry and the regulatory agencies, is a strong focus of activity at the moment to make sure that we get ahead of these outbreaks and make sure that the most important thing that the sector can do is both continue and improve their COVID-safe plans, but equally make sure that they do their bit for the high levels of vaccination that all sectors need to know. Construction companies do have the responsibility to stick to their COVID-safe plans and to make sure that all the things that go with that apply on construction sites, that everyone is checking in, that you have the correct density number of workers on site, that all workers test at the first sign of any symptoms, and that, of course, anyone that's eligible needs to get a vaccine as soon as they possibly can. And of course, we use this as an opportunity to just remind employers in the sector, COVID-safe plans also include making sure that you give your workforce the opportunity to get vaccinated. And with that, the support and the time off that is required. So if I had one message today, it was that all workers, big and small, in the construction industry need to make sure that they follow the rules and that the time for continuing to hand out warnings in the sector is over, and that a combination of the authorised officers, WorkSafe inspectors, and indeed the leadership of the sector itself is about making sure that the spike that we've seen in construction-related cases comes to an end. And the efforts that the public health team, the regulatory agencies and safety agencies in the sector and the sector itself are all resolved to make sure that construction is a safe place to work, but it needs to demonstrate its credentials in this regard. Deputy Secretary Matson will take us through the map, if you like, of the cases before us today, not just in the regions, but particularly the metropolitan areas. But could I take this opportunity to introduce Dr. Ryan Hodges from Monash Health. Dr. Hodges is one of the country's leading experts in managing complex pregnancies and particularly the issues relating to pregnancy and vaccinations. And I just wanted to preempt what he's saying by just making it clear that as of tomorrow, any woman who is pregnant from 24 weeks onwards in their pregnancy will be able to get priority access through any of our state-run vaccine centres in the same context that our frontline healthcare workers and aged care workers are able to. You are a priority group, and it's important that you and your support, be that your partner, be that your home-based supports, also get vaccinated as soon as you possibly can for the reasons that Dr. Hodges will take you through. So could I please hand over to Ryan and then Kate, and then we're happy to take questions.